to today's vote. Are you relieved? Is this a step in the right direction?
Well, this is a good day for NHS staff who will benefit from this pay rise, an extra over £5,000 for a Band 6 nurse or paramedic or midwife. So it's a good day for NHS staff, but it's also a good day for patients. It will allow us to move forward. Now the NHS Staff Council has ratified this deal. It's been accepted by the majority of the NHS Staff Council, and we can now move forward, focus together on the patients, and also ensure that staff get the pay rise much sooner than would have been the case under the pay review body process.
There are some unions who aren't particularly happy about this, which means strikes will probably keep going. Are you going to get back round the negotiating table, or is this the final offer?
Well, it is the final offer, and it's important that those unions recognise the collective decision. This was a decision taken by 14 health unions. They reached a majority decision. It was negotiated collectively. The RCN were at the negotiating table. Indeed, Pat Cullen recommended this deal to her own members. So it's important that everyone now respects the decision of the NHS Staff Council. It's an opportunity to now come together. There's further areas where we can work collaboratively in terms of some of the non-pay issues that we discussed during the negotiations. So I'm looking forward to working with trade union colleagues on those issues. But it's a good day for NHS staff. It's a good day for patients. An opportunity now to get that pay into staff's pay packets next month, and for everyone to move forward together.
Now, this obviously doesn't include junior doctors. You're meeting with them later. They're far from happy. Do you think you'll get closer to offering them the 35% pay rise that they're looking for?
Well, I think what the deal with the Staff Council shows is the willingness of the government to enter into meaningful, constructive negotiations with trade unions. That's what we've done with the Agenda for Change staff, covering more than 1 million NHS workers. We've also listened to doctors in terms of pension changes. That was a key demand, particularly of many consultants, that we make changes to pensions, and the Chancellor did that in the budget. So we've shown that we're willing to engage constructively in meaningful conversations. That's reflected in the really positive decision today by the NHS Staff Council, and I hope we can take that into the discussions with the junior doctors who are meeting later today.
Now, you worked in number 10. Have you got confidence in Simon Case, and are you concerned about what's happened around Sue Gray's appointment, potentially, as Labour's Chief of Staff?
Yes, I do have confidence in the Cabinet Secretary, and it's important that ministers and senior civil servants work constructively together. I'm sure that's the case in number 10. It was when I was there.
Health Secretary.
So that's the Health Secretary Steve Barclay reacting to this deal done with 12 of the 14 health unions, the NHS Staff Council, that have accepted this deal.